Hello, everyone. I'm Susan Cole.
And I'm Vanessa Apea.
And welcome to Health and Power, the live broadcast series on health inequalities affecting people of colour and, crucially, steps we need to take to address it.
Great. Thank you so much, Susan. Well, today, as ever, we've got some wonderful guests and really excited for the conversation that we're going to have. First of all, we have Naabil Khan, and Naabil is a third-year medical student who's studying at the University of Exeter. And as well as completing a medical degree, which isn't enough, she's a podcast host, website creator, and avid activist for representation and diversity in healthcare and also medical education. She's actively involved in various initiatives to raise awareness about Black, Asian, and minority ethnic issues, as well as presenting to the British Medical Association and the General Medical Council on decolonising healthcare. And through her various initiatives, Naabil is really making significant impact in promoting diversity, inclusion, and representation within the medical community and healthcare system. And her commitment is really to be creating an equitable and accessible healthcare system, has also been witnessed with the creation of Skin for All, which is an online educational platform that represents the most commonly seen skin conditions on various skin tones. And really, I can't wait to discuss it with her. So really looking forward to that conversation. And then we also have the lovely Dwayne-Wilson Hunt, or Dee, who is a nurse specialist in sexual and reproductive health and HIV at one of the busiest clinics in Europe. In 2021, he was appointed the chair of a newly formed racially minoritized communities special interest group, which is within the British Association of Sexual Health and HIV. And this group is targeted to look at the sexual health and also HIV inequalities that exist within ethnic minorities. He's spoken for BASH, the Faculty of Sexual and Reproductive Health, BBC News, BBC Radio, at the London School of Hygiene and Tropical Medicine, and has held lectures at King's College London and the University of Brighton. And more recently, I had the pleasure of being there where he made his international debut talking at the International Conference of Sexual Health in Chicago. And he's also published a number of articles. So we have got fantastic guests who are deeply committed to health inequalities.
That's so exciting. I'm really thrilled to have them both on. And it's really interesting about skin colour and health inequalities. I know that the Race and Health Observatory recently released a report on skin colour in newborn babies, and that's an issue that's affected me. When my son, who's now 18, was born, I noticed that he was a slightly kind of like yellow colour. He was the third child of mine, so I was quite aware of what my kids look like, and I raised it with the doctor or a nurse, and they said to me, "Oh, don't worry, that's just the colour that mixed race babies come out." And I knew that wasn't the case, and later on it was found that he did indeed have jaundice. So is this an issue that comes up a lot, Vanessa?
Unfortunately, yes. And I think, I had a very similar experience with my son, where there was kind of delayed recognition. And I think that's one of the most powerful things about the Race and Health Observatory is really bringing all the evidence together. So, your experience, my experience, experiences which are documented in journals, to then say, right, this is something that is actually very true, very prevalent, and we need to change things. And it's something that I'm sure we've got many people that are listening that can give a story or similar stories. So it is crucially important that we really learn how to look at different conditions in people of different colors. Yeah.
Absolutely. So shall we bring on Naabil?
Hi.
Hi, Naabil. Thank you so much for coming on. And you've been doing an absolutely amazing job. It's
Thank
incredible what
you.
you're doing. In terms of like raising issues on racial inequities, particularly in medical education, what impact do you think the inequities in education are having on perspectives in the NHS?
I think it's a really interesting question, and it's very complex when you think about it. The inequities seen within medical education can be seen in student perspectives. There was a study that was carried out in Washington in, I think it was 2018, about the perspectives between white and black skin amongst medical students. And unfortunately, a vast majority of medical students had conceived black skin to be thicker and black skin to have a higher pain tolerance. And as we know, this isn't true. This isn't accurate. So these perspectives of health inequalities and distorted kind of views towards different skin types are still prevalent within medical education, and you can see how it translates to the workforce, because if you have students who are still holding on to these distorted perceptions, you're going to have doctors who are holding on to these distorted perceptions, and without actually having the proper interventions and the proper educational I guess techniques and barriers put into place, you won't be able to debunk those perspectives that students have. So I think it holds a really, really huge significance when it comes to the ideas the future of our medical workforce actually has.
Thanks so much, Naabil. And it's really made me think a lot about, my medical education a number of years ago, but just in terms of the language and even the scenarios that are put forward about it as well. And unfortunately, I don't think then we questioned enough. We just accepted what we were given, and we were focused just on, getting through it. And so it's just great to see people like yourself and the kind of culture that there is that's happening to really change things. And so if you had control over all of medical education, what changes would you like to see in medical education?
Well, I tend to kind of view the changes that can be made to medical education through there's this quote that Jules Lipoff actually says, which is black and brown skin has been perceived as the asterisk, whereas white skin has been perceived as the default. And I would like to see a change from that, that we aren't the asterisk, we aren't the extra, we are actually normalized within medical education and medicine as a whole. So I would like, I guess, for the future of this movement and of medical education and of the culture behind medical education to become more normalized behind, representation of all skin types and not just white skin.
Yeah, absolutely. And very often we talk about the problems of racial health inequities, but you're actually taking action to address it with your website. What drove you to actually create Skin for All?
That's a really interesting question. Actually, it was partly due to you, as well as Annabelle and Dee, when I met you guys at the book launch. I think that was a couple of months ago. Um, when I went to that book launch, I didn't feel so alone in terms of my concerns about medical education as a whole. When I was looking at my case studies while I was doing lectures in first and second year, it just seemed to be a constant reoccurrence that certain racial biases and certain scenarios focusing on certain racial ethnic groups um, were underrepresented as well as overrepresented. So things such as sexual diseases or sexually transmitted diseases were overrepresented on black and brown skin, whereas diseases that you would commonly see, such as like eczema or asthma or something like that, would always be seen in on white skin or on white patients. And that's how we were taught. It was kind of There was this kind of culture where white skin was associated with the so-called commonly seen conditions, whereas black and brown skin was seen with these, quite taboo conditions, and in the past have been seen as quite taboo. So it angered me. And then I did further reading. I found out about the work of Malone McQuendy, who created the amazing resource which is Mind the Gap. So I looked into that, and I did find, the differences between websites like Mind the Gap and the NHS website, for example, where you have only certain conditions which show black and brown skin as well as white skin. And then you have certain conditions like jaundice. That has now been changed, but in the past, jaundice just showed white skin. So you'd only associate jaundice with just that yellow discoloration. So that fueled me. And then kind of the cherry on the top was going to the book signing of Divided by Annabelle. And kind of, just being reaffirmed that I'm not alone in this movement, and there are people who are there to support me. And if I do want to actually make a change, especially within my university, which is Exeter, which has, being completely honest, has been known to not be diverse and to not address diversity as commonly as other universities. So I thought, let's hope that this book signing event will kind of launch my career or launch my journey into actually making a change within Exeter. So that is what inspired me to start creating the website Skin for All. Yeah.
Wow. I love that. I know. I think the thing that really stands out about what you just said is that you're sitting there and you know that something's wrong. You want to do something about it, and then you go somewhere where you realize that you're not alone, because activism can sometimes be really lonely. And when you do find your people and people that have aligned thought, it can change the world. Not to be overly cliche, but it can. And I think what you've just said is so important. So thank you for sharing that. And I just wanted to pick up just in the last few minutes about, first of all, again, kudos, because as you said, the university that you're based in may not have been typically at the forefront of diversity and inclusion. And I think there'll be people that are listening and that will be listening when thinking about decolonizing anything, whether it's healthcare, whether it's education. I'm sure they will come up against certain challenges. And I just wondered if you wanted to share any challenges that you may have had, because I think in that same way may inspire others as well.
Yeah, no, well, exactly like you said, activism can be quite isolating sometimes because you feel like everybody else around you isn't as concerned about an issue that you're particularly concerned about. So, trying to overcome the barrier of actually getting people around you, such as other medical students, to care about this issue, where they might not potentially come from a similar background to you or ethnic group, but actually saying to them, this has life-changing consequences for the people that we are treating in the future. Like, we have to start now, because it will be too late by the time we get into the healthcare profession and then suddenly realize, oh God, I've had all of these preconceived conceptions about different types of people and where they come from. This is going to have real life consequences, and for the most part, if not all, in all of the scenarios, for the worse. So that's one of the biggest barriers, trying to actually find that interest amongst your cohorts around you. I would say another kind of barrier that you face is also just starting the conversation. So in Exeter, I will say it has in the past been known for not really focusing on representation, but it has now, which is brilliant. There are steps being taken. But I know, while talking to my other colleagues at Exeter, that it's really hard to overcome those steps in terms of trying to start the conversation with people. Similar to my first point, it's something people might not even think about because they come from certain backgrounds which haven't had to think about that, for example. And in Exeter, when you're looking at the demographic as well, everyone comes from so many very different places, and they have different backgrounds, they have different stories. So trying to actually unify everyone and focus on this certain cause is quite difficult, but hopefully we're taking the steps to actually get there and actually say to everyone, this is an issue that concerns everyone and will have real life consequences for everyone. So yeah, I would say probably those two are the biggest barriers, but working towards them and trying to overcome them.
Wow.
Fantastic. Oh.
That's so brilliant. Thank you so much, Naabil, for coming on. It's just truly inspirational.
Thank you for having me, both of you.
No, not at all. And we have your website scrolling on the screen, so for people to look at. So please go on. Skin for All.
Brilliant.
Skin for All. Very cool. Check it out. Oh my goodness. Yeah, that's so inspirational and so important in terms of raising those issues from while you're at university.
No, definitely. I think, when you're in the thick of it and you can see something that is just for you deeply wrong, and then you're having the space and drive to change it, I think it is really, truly inspiring. And I love the fact that yourself, Annabelle, and Dee can all take some credit.
But I think it's such an important point, just in terms of, kind of like knowing your tribe. And being in a safe space can really inspire. I mean, it certainly inspires me.
No, definitely.
Having these opportunities, actually.
Well, no, completely. And I think that, we should never underestimate safe spaces. Safe spaces can create so much, and you really can't take them for granted, because there are not many safe spaces to have conversations such as this, and to be lighthearted about it and say, right, this is what I'm feeling. What do you think, etc. So no, it's great to see it. Great to see.
Absolutely. And talking about safe spaces, UK Black Pride, what an incredible safe space for so many people.
Absolutely amazing. And I'm devastated because I couldn't go this year, and I went last year, and it was amazing. And I worked with wonderful colleagues at the Love Tank from our hospitals in Barts and Homerton to provide monkeypox vaccination. And I wasn't there this year, but it went on, and they provided monkeypox vaccination at UK Black Pride. But it's the atmosphere, it's the energy, and yes, completely a really deeply safe space. So yes,
absolutely. And shall we bring on Dee?
Hello.
Hi, Dee, the inspiration for that incredible website. Take the credit.
My God, it's wonderful, like what we are able to do as a community and inspire. And I think this is why I really enjoy what I do, because I think the fact that Naabil was saying that a conversation that she had with us at Annabelle's book launch inspired her, I think, is just like that safe space that she was able to talk about how she felt and share it, and now share it with the rest of the world, and hopefully change a lot of things in education. So thank you, Naabil.
No, well, linking that on, yes, you were the part of the inspiration, but I think I don't think that's the only space in which you've been really inspiring people. And I think we've got lots to talk about. But one thing I wanted to bring up, don't be shy, Dee. One thing I wanted to really talk to you about was just yourself as a nurse and a specialist nurse, and being Black and being male and being in that space and what that means. And I just wanted to, if you could talk about some of your reflections on that, because I think that representation is really, truly powerful.
Yeah, I don't think I realized how important representation was until one of my colleagues said to me, "I'm so glad that you work here, because it's nice to see someone who looks like them in a position that I'm in a senior position." And that was just really inspiring. And I think then I hadn't actually thought about it, and I was like, oh wow, I am doing stuff, and I'm in that place where other people, I didn't get the chance to see people who look like me in senior positions or in positions doing bits. I won't lie, I didn't probably realize what was going on around me, and attributing it to racism or being mistreated differently. So like, as a queer Black man, I was focusing on that first part. I was focusing on being queer and trying to cope, because, I can hide my queerness sometimes. But now, like, you can't hide your Blackness. So I'm always going to be Black. But I stayed in the closet for so long to try and suppress that aspect, to then go through university, not probably having some experiences. And I think it was a reflection when I had my first job in the NHS that I had an experience that I reflected on afterwards. And I won't dwell too much on it, but I had a different experience in a position with a white colleague. And it was just very interesting, the response that this colleague got from a request. And I had asked for that same request about 10 minutes before. And it took me a while to kind of think, what was that? What was going on there? And actually, like on reflection, like I have to own that. I have to realize actually it was probably because of the color of my skin. And I don't think it was an intentional bias, but it was a bias. So it's really nice to now be in a position as the chair of the RMC SIG, as a nurse, as a Black man, as a queer Black man in positions of, I guess, somewhat authority and seniority to be that representation, like Naabil was saying, you know, that can then inspire people to do great things in our community.
Yeah, absolutely. And why do you think it is so important that we have this special interest group that focuses on race and sexual health?
I mean, I'll pose that question back to you, Susan. Why do we have groups for men who have sex with men? Because we realize that there are these groups that have needs that are specialist to the non-cis het white British male, you know, form. The data is there, and you know, people love numbers. The data has shown these disparities for years, for decades, and we need to do something about it. And I think it's really important that BASH came along and said, actually, we need to have this group, because I think BASH have so much influence within sexual health, within healthcare, that we should be seen as the pillars and the poster people for this movement. I think a lot of these community organizations do some really amazing work, but what I feel like they aren't able to reach is the masses in comparison to the scope that, say, BASH would have. And it's really great that within the special interest group, we have lots of community organizational reps, which means that we're able to be like, actually, you're doing this really great work. Let's amplify what you're doing. Let's use your audience. Let's use our audience. And let's use, you know, our public health background and all this stuff to spread the word. And, you know, as you're both aware, BASH isn't just made up of doctors anymore. It's got nurses, health advisors, it's got people from the community like yourself, Susan, and lots of great people across the spectrum. And generally, a lot of the people within the SIG also don't just work in sexual health. So there's so much of a reach, which is great.
It's so true. Thanks, Dee, because I think that whole thing of amplification, collaboration, and being able to take it into spheres that is not just sexual health and HIV, but also recognizing that changing policy is about collective action and bringing that together. And I think the SIG and the racially minoritized community SIG, just as a reminder for people, has been really, really pivotal in kind of bringing these issues to the forefront, which is fantastic. And, you know, we mentioned UK Black Pride. And one of the important things about UK Black Pride is that, as we said, it is a safe space and it's responded to a specific need. And just kind of thinking about that and thinking about the work that you do, and also with the SIG, what do you think needs to evolve, really, particularly in sexual health provision, particularly in like outreach, to really meet the needs of everyone?
Wow. I think the first thing we need to do is make sure that the industry that we work in looks like the world that we look after, the people that we care for. And I think that doesn't happen. So what I think then happens is there's a lot of mistrust. People don't see someone who looks like them and isn't willing to share how they're feeling truly. And I'm sure, you know, you've had experience with this as well, Vanessa, where you know a patient is wanting to say something, but they're not sharing that. So I think it's really important that there's representation. You know, we always say this word representation, that people look like you are there, and it helps then people come into the industry and to help make things better, but it also helps the patients, I believe. outreach is very difficult because there are certain communities that have such a distrust of health services and the health system. But I think there are ways that we do collaboration. We work with these people. So, you know, as I said before, having people from the community and community organizations within the SIG from that community, working with people collaboratively together with people who, you know, from the barbershop, you know, from their faith organization, and having those conversations and opening up that conversation, opening up that exploration, and, you know, dispelling these mistrusts and these rumors. And it's so difficult. But, you know, Tuskegee messed that up. You know, lots of things messed it up. COVID messed it up. And it just seems like we just don't, and I have to say we collectively as health providers, we just keep making the same mistakes. You know, I saw it again through MPOX. So we have to work with the community. I'm part of that community, but I'm also a health provider. So I have to listen to the community and hear what they say. What do you want? What will help you? And instead of the white man in the top going, this is what we're going to do. No, what do they want to do? You know, it's like talking about women's ovaries and women's reproductive organs. Like, why is a white man deciding how a woman's going to cope? Anyway, that's another conversation. But
yeah, thank you. Yes, we definitely want to have, and you raise really important points there. And certainly in terms of the health inequities that we see, it goes across so many different disease areas, and it's stark in HIV where you work. And many of the people that I work with say to me that, you know, when they raise their concerns, or when they say things like, I'm putting on a lot of weight, I think it's linked to my medication, or, you know, I'm being ping-ponged around between healthcare professionals, particularly Black women, they're not believed. And some people are saying to me, you know, well, what's the point of raising concerns when no one's actually going to believe me? What advice would you give to a Black person living with HIV who feels that they're not getting the care that they deserve?
Go to someone else. Like, ask someone else. If you don't feel like the person who's giving you care is giving you the care that you deserve, you ask for someone else. You know, I was talking to my mother recently, and I hope she won't mind me saying, she had some blood tests done recently, and the phlebotomist was, on the initial meeting, was not very courteous or kind or compassionate to my mum, and gave my mum a bruise. And my mum's got darker skin than me, so sometimes people say, oh, I can't see your veins because of how dark your skin is. That's a lie. So the second time she went, she requested to be booked in with another phlebotomist. She arrived, the phlebotomist was actually not there, and she was booked in with the phlebotomist who was not very nice. And then my mum ended up having to leave, come back and have another appointment. And I said, well, why didn't you ask if there was someone else there? She's like, I didn't want to make a fuss. And I was like, no, it's not a fuss. It's your health. It's your care. I was like, you are entitled to be seen by whoever you want to. And if you don't feel someone is giving you the care and respect that you need, you ask someone else. There's that aspect. But also, the NHS isn't made to be easy for everyone, unfortunately. And working in HIV care, I see that a lot, because HIV generally, the patients I see are very well with their HIV. It's all the other comorbidities that they have, which makes it harder to manage. But then they're thrown around so many different services. So, you know, you've got their cholesterol, their diabetes, their COPD. And it's so much out of our control as HIV care providers that we can only do so much. If it's related to their HIV, then I can really help and support. But if it's not related to their HIV, I'm very limited on what I can do. And a lot of it has to then go back to the GP. And the GPs then will say, we didn't get the letters. And I know Vanessa and I, we write those letters. You know, those letters get sent. We spend time dictating those or writing those letters, and they get sent. So then the GPs are also overburdened. So I think something needs to be done to make it easier for these patients to access care. And I think COVID just totally ruined that. And it opened up the digital aspect, the virtual aspect, but it also, you know, got rid of a lot of great things and great opportunities of people accessing, and they just make it even more difficult. So I think, yeah, if you're not happy with the care that you're receiving, if you're not being listened to, when you go to that reception, say, I would like to see someone else. Remember that person's name, say, I'd like to see someone else. And they should provide that care for you.
Thank you so much, Dee.
Brilliant.
As ever, that was really a great conversation. And I think what you've ended there is really important. Just, you know, health and power is like really, again, cliche, but it's what you're saying is it's about people recognizing the power they have as individuals. And if you're not receiving what you need, then you have to make that clear because you deserve better. So no, thank you for putting it so eloquently. And it's been great to speak to you.
Yay,
Thank you.
Thanks so much. Bye. And I can't believe we've run out of time already.
Always happens.
A huge thanks to Dee and Naabil. Thank you to Disruptive Live for putting this all on and for the lottery to fund the broadcast.
No, definitely. And thank you to you, Susan, as ever, for being a wonderful co-host. And we'll see everyone next month. And we really look forward to seeing you all again.
And thank you, Vanessa. See you next month, everyone. Bye.
Bye.